you'll be wondering how come dementia is being seen by probably various different specialties, not just psychiatrists. I do specialize in elderly psychiatry, so old age psychiatry or psychogeriatrician see persons with dementia. Other than that, I think the neurologists, even the geriatrician, also do see people with dementia. Yeah. Okay. So dementia is a condition that that has high disease burden. Before sharing more about dementia, probably want to take a look more into the prevalence of dementia. You all heard of World Health Organization, WHO, has actually included dementia as a priority public health condition. And this condition actually contributes to the global non-communicable disease burden. As we know that this disease doesn't just affect the individual, it also causes burden to the caregiver and the community at large. And globally, dementia is the second largest cause of disability among people aged 70 and above. And unfortunately, it's the seventh leading cause of death in the world as well. So let's take a look at the prevalence of dementia in the world. Worldwide, you can see that the numbers are quite high. You can see worldwide in 10 years' time, the numbers will increase to 74 million of people diagnosed with dementia. And among the different continents, I think Asia has the highest highest prevalence. By 2050, 67 million will be diagnosed with dementia, which is almost half of the world population. The world statistic by 2050, 131 million people will be diagnosed with dementia in the world. So you can imagine that actually every 3 seconds, one person will be diagnosed with dementia. And bring you back to the local statistic, the dementia in Singapore. 1 in 10 people in Singapore over 60 years old may have that dementia by 2030. And as we know that the prevalence the risk increases when the person ages. So 1 in 2 in people above 85 years old will be diagnosed with dementia. So as of now, the statistic, probably around more than 80,000 people in Singapore has been diagnosed with dementia. And this number gonna double up. In 2050, it will be around 187,000 people will be diagnosed with dementia. Yeah, so you can see that the numbers are quite high, and it actually affects around 5% of the Singapore residents aged 60 and above. Yeah, so maybe I want to bring you more into the aspect about the disease. What is dementia as a general? Yeah. Now, dementia is an illness which affect the brain, causing the brain to die at a faster rate than normal. So it is a condition, an illness. It is not a normal aging. Yes, we can, as we age, we might be more forgetful, but dementia is a forgetfulness that is not normal, and it progresses over the years. It is a slow disease, progressive disease, and unfortunately, there's no medicine that can cure or stop the progression. So the medication that the doctors may prescribe can only slow down the disease progression, but will not stop or even reverse the condition. If you look at this picture, so healthy brain look like this, but in person diagnosed with dementia, or in this picture, Alzheimer's AD is Alzheimer's disease brain. The brain shrink at much higher rate, faster rate compared to the peer. Yeah? And you can see the shrinkage of the brain is very much significant compared to the normal healthy brain. Okay. Yeah. So as I mentioned, dementia is a forgetfulness that is not normal, and this causes a lot of disability to the patient. They have inability to coordinate and even interpret the environment accurately, and can cause a lot of problem because they may find difficulty navigating their surrounding, and that they have a lot of difficulty coping with their daily activities. So it becomes a a problem, a disorder when it starts affecting the person, affecting them as a person, affecting their function, and the people around them will will be able to pick up the change, the significant change in the patient. Yeah. So looking at the dementia types, we have few types of dementia. The commonest is Alzheimer's dementia, or we call Alzheimer's disease. Make up more than 50% of the dementia cases, and followed by vascular dementia. We hear vascular mostly can related to vessel changes in the brain, like infarct or stroke, even due to other occlusion in the brain, and other types of dementia such as frontotemporal, time to time the clinic. Following me so far? Yeah. Okay. Right. So maybe I want to also talk a little bit more about normal aging versus dementia. Yeah. Okay. A lot of time, my patient or family members will come and ask me, my patient will ask about the family members like, my parent has forgetfulness. Is this normal, or is she or he having dementia? So it is normal, as you know, our memory might be a bit slower as we grow older, but it should not affect our function too significantly, and we still are able to navigate this, our daily routine. So in normal aging, often we can see that there's occasionally forgetting event or list of things. For example, I have patients who would go to the market, but often they are able to recall that, when they get out of the market, then they remember that they actually forget to buy certain things, and they are able to remind themselves again, and able to then switch back and buy their things. But then in dementia, often the patients are often forgetful, and a lot of times they're actually not aware that they are actually very forgetful. Yeah. And for example, they may not even remember that they need to go and buy things in the market, or they can't even remember the list of things that they want to do. And this memory problem that disrupt their daily life. So this is abnormal forgetfulness. Yeah. In another example, in normal aging, sometimes we tend to forget certain dates. Even I myself tend to forget dates, to put some reminders in the calendar. That can be because we are busy and occupied with activities. But often we can retrieve the accurate information of the date. We will check the newspaper, check the calendar, sometimes not too far off from the actual date. Whereas in dementia, they can get very confused with time. I've seen a lot of cases where which year, which time, they are not able to recall even after being corrected. You can reorientate and correct them, but after that, when you check back with them, they cannot remember at all. Yeah. And some in normal aging, sporadically, people do make careless mistakes, but sporadic, and often they are aware of that mistake. Whereas in dementia, they have problem, they struggle to perform routine tasks, even basic things that they used to do, or like showering, feeding themselves, or wearing their clothes, and more complex tasks like managing their finances. They may not even be able to do that. Yeah. And normal aging, there are times where we start losing our things, but often we can retrace steps to find the things again, the things that's lost. For example, I have a patient who told me that he will misplace the key, but he is able to trace back the places that he will put the keys, that he might the possible places that he will put his keys, and oftentimes you'll be able to retrace that lost item. Whereas in dementia, often they misplace their things and would even not, sometimes accuse of people around them of stealing, because they cannot remember at all. Yeah. So one example is that I have a patient who might even place. I mean, she lost her I can't remember, was it a, I think, yeah, she lost her pot, a pan she used to cook. So she couldn't find the pan anywhere. But suddenly, when the children actually opened the shoe cabinet and found the pan inside the shoe cabinet, so it's not the usual place where you would place your cooking pan in. So oftentimes they might get very confused and they might misplace things. And sometimes they might start accusing people, especially like they have a helper. They might accuse the helper stole my things, stole my gold, my money. Well, a lot of time they keep it, but they cannot remember. Yeah. And then another example is in normal aging. They will, a lot of time, because they cannot remember, when they recognize that they cannot remember things, they might make an effort to write down certain lists to reinforce the memory. Whereas in patients with dementia, they are not able to even organize all these daily routine and might be very dependent on others for help. Okay. Right. So when these are some of the possible examples and encounters that you might see in people that you encounter in the community. So how can we actually recognize persons with dementia? So I quoted some source from the Dementia Friendly Singapore, even in AIC. So simple ABC signs and symptoms of dementia would be helpful for you to remember. So A means activity of daily living. Uh, Oftentimes, persons with dementia may not be able to do their daily activities or simple tasks, even as I mentioned, like wearing clothes. They may they cannot button their clothes. Yeah, their clothing or appearance may appear unkempt or quite haphazard clothing. Yeah, they forget to shower. They don't know how to comb their hair. Yeah, that's A. So B will be behavioral changes, and sometimes the person with dementia may have behavioral related issues. They may become socially withdrawn or depressed. They may even lose interest in activities. They become more quiet, uh, uh, or some may even become very irritable, paranoid, accusing of people, stealing their things, coming to their house. So there may be changes to their mood. They may appear anxious. They may appear depressed, irritable. Some of them may even may appear very lost and start wandering in the community. Okay, and C is the cognitive decline. Cognitive means the ability or brain function. So cognitive decline simply means that the person with dementia are not able to perform things like calculation, language impairment. So they may not be able to understand certain words. They have difficulty expressing themselves. Yeah. Then the commonest one would be the forgetfulness. They forget most often in dementia. They tend to forget things that are recent. So a lot of time family members will come and tell me that I repeat the same thing, but he will repeat the same question and doesn't seem be able to register any information at all. So that's what happened in dementia. They cannot register, they cannot retain any information, they cannot learn new things. But interestingly, they are able to retain information that are way, way, way back, many, many years ago. What we call their long-term memory is intact, whereas their short-term memory, things that occur recently, they are not able to remember. So they cannot retain the information. So if you ask them about their job, maybe 30, 40 years ago, they can tell you clearly the timeline. They can tell you all the information, their childhood, the childhood events. But if you ask them about what happened last week, last month, they are not able to recall. Yeah. And D is disorientation, simply means inability to recognize like places, people, or even time. So they may be very confused with the time, as I mentioned just now, and familiar places, they may also appear unfamiliar to them. Yeah. And sometimes they start losing memories about about people around them or their neighbors, and eventually the more severe one, they may start forgetting or not recognizing their family members, especially like usually they will forget those distant relatives, but when the disease progresses further, they might even forget who their children are and even their grandchildren as well. Okay, right. And I know because there are police that's participating in this talk, so I also want to highlight that sometimes persons with dementia may get into trouble with the law. We have seen cases where they are being charged for shoplifting. Yeah, reason simply because they actually forget to pay. So they may not even remember why they appear in the shop. They may take things that they thought they might want, and they might just walk out without remembering that they need to pay for that item. So it may appear intentional, but actually they forget what they are supposed to do. So a lot of time they are caught for shoplifting. But I do have cases where they are so familiar in the. I mean, they are my patients very familiar with the people in the community at his block. So often when he goes to the same shop to take things, and the shop owner will actually list down the items and bill it to the children after that, because they recognize that he has dementia, and they usually will antagonize the patient, or even will not confront the patient. Yeah, I also have cases where the my patient also goes up, use the bus without actually tapping. But a lot of time, I think the bus drivers are also quite aware, and they usually will not confront the patient as well. There are also cases where they are charged for indecent exposure. Unfortunately, in dementia, they might start to forget, might not be able to they forget the societal norm. They might not recognize the appropriateness of the situation. For example, like I have cases where I have a patient many years ago. She forgets that she needs to her dressing. She was not able to dress herself very appropriately. So many times she would dress her undergarment outside of her pants, which was causing a lot of stress to the children, because she would go out with her undergarment outside, or sometimes they go out with their pajamas. So sometimes they may leave the house without appropriate attire, or they start undressing in public without recognizing, as I mentioned, because they cannot recognize the societal norm. So they might start undressing, and then they might be charged for indecent exposure. Yeah. And I also have a lot of cases where they have false report. They call police repeatedly and accusing of family members or intruders, going to their house, stealing their things, or they might go around in the community downstairs, downstairs in their block, telling people that they don't know the family, trying to starve them, not giving food. So a lot of times it's because they cannot remember that they have eaten, or they can't remember where they placed their things, so they might start accusing people of of all this. So false reporting is very common as well. And as during the recent COVID situation, and we do see where seniors also appear disobeying the law, oftentimes also because they forget what are the recent rules like. No, they are not aware, like they see the red tape, but they cannot recognize that it means no entry. So they simply cannot remember, or cannot interpret that, and or even the mask. So they cannot. For one moment they might wear mask, then the next moment they forget that they need to wear mask, and they felt uncomfortable having something around their face. They might just remove their mask. So this can, I think, have occurred quite frequently in the community as well. Yeah, so these are the common causes, and I do have other situations where not common, like patient littering outside of the window because he is not able to control some of his behaviors, or litter urine outside the window as well. So there are a wide variety and different types of behavioral issues person with dementia may face, and this can get them into trouble with the laws. Yeah. Okay. now probably want to talk to you also about what are the problems other than those, what are the different types of problems that person with dementia have. So as mentioned, recent memory, they cannot remember things, they cannot learn new things, they cannot retain information. Because cognitive function is very wide. It involves not only memory, it also involves language, involve coordination, involve visual spatial. So they have problem with visual spatial, eyesight problem. They cannot estimate the space around them. A lot of time, patient with dementia has problem driving as well. They may get into accidents a lot. Yeah, and they may have problem coordinating with coordination. They may present with frequent falls. And as I mentioned, they have difficulty with language, so they may have difficulty in communicating, expressing their needs. Yeah, because they start losing memories of things around them and people around them. They might have difficulty in recognizing places and time. They start misplacing things, and they may even have problem completing familiar tasks. For example, a housewife who has dementia may not be able to do any, may not be able to perform some of the housework or even cooking. So these are the commonest, like when they start having problem performing things that they used to be able to perform, it becomes a problem. Yeah. Okay. So what is of dementia in person with dementia? Obviously, they may get into a lot of problems like getting lost in familiar places. Yeah. Sometimes they might go out and not remember what they need to do. They may, as I mentioned, they cannot remember, the time perception is also affected. So sometimes they may even go out in the middle of the night, and because they cannot recognize familiar places, they may get lost. They're not able to go home. They may start wandering around the community, and they may not be able to recognize people, family members. Sometimes they may bump into the relative, but they cannot recognize the relative in the community. And often this can lead to mistrust. They start become very paranoid, start thinking that why is there a unfamiliar person living in the same house? Yeah. And this can lead to a lot of emotional changes as well. They may feel very afraid, confused, they may feel lost, they don't know what to do. They may feel very irritable because nobody understands what they are going through, or they themselves don't understand what is going on as well. And sometimes they may face with some safety issue, like forget to turn off gas stove, they cause burn to the kitchen, they forget to lock the door, then even road safety, sometimes they are not able to abide by the law, and they may lose their direction while driving, or even because of their poor visual spatial ability, they may get into accident. And as I mentioned, dementia not only affect the person, it also affect the caregiver. So caregiver face lots of challenges managing persons with dementia. I thought it would be helpful to put in this slide so that when we see person with dementia, we oftentimes they are brought by their caregivers. So probably it would be good to recognize what are the problems that the caregiver might face and how we can advise them. The caregivers oftentimes they feel very stressed managing a family member of their loved ones with dementia, very frustrated, very confused, like why oftentimes they will feel like, how come, is there something wrong that I've done? Why can't my parent remember who I am? You feel very confused, like why at one moment my parent seems to be able to recognize me, the next moment I feel like a complete stranger. And they also face high caregiver burnout. Look at this statistic down here. 61% of caregivers actually report a high or very high emotional stress, and 39% of them actually fall into depression compared to 17% of non-caregivers of dementia. Yeah, and 59, more than half of them mentioned felt that they feel that they are on duty 24/7, having to look after the person with dementia all the time, especially when they are not able to, they have poor time perception. Even at night, caregivers may not get proper sleep as well. This can lead to high risk of burnout. So probably a simple 5 tips for caregivers of persons with dementia is really to manage stress level. Yeah, easier said than done, but a lot of time is to really have a balanced lifestyle. We try to distribute some of the duty with other family members and not take on the responsibility alone. Yeah, really be realistic, because a lot of time we have to reduce the expectation. Person with dementia will go back to what they were before. Really be realistic and accept change in that person, and really to give themselves credit and do not feel guilty about what they can't do, but more focus on what they can do for the persons with dementia. And often we'll ask them to take a break, respite, so that they can recharge and re-energize before they can take on the role or responsibility of caring for a person with dementia, because it's going to be a marathon. Yeah. Okay. So this I quoted from Dementia Friendly Singapore website. There are caregiver support group, community support group, and the caregiver support network. Yeah, including Bram Center is also part of the network. Okay, right. And as in the community, what can we do to help and support persons with dementia? Not sure if you ever heard of Dementia Friendly Community. Singapore is creating a Dementia Friendly community across the country to support uh, people or persons living with dementia, to help them age in place with a vision to make Singapore a dementia friendly nation. So dementia friendly community is envisaged as a neighborhood where there is good public awareness of dementia and understanding of how we can better support and care for people living with dementia. Yeah. So we also want to make them feel respected and being able to move around safely with ease and continue to lead meaningful life even though they suffer from dementia. So you you want to imagine yourself being in a community where you want to be treated if one day you do have such condition. Yeah, so we want people living with dementia and their caregivers to feel included and supported in the community. And so far, the dementia friendly communities across Singapore includes Yishun, Hong Kong North, MacPherson, Bedok, Fengshan area, and Woodlands, and even and many more. Um, so a dementia friendly committee is really about public awareness and how we can recognize and help them, help people with dementia and also their caregivers. Okay, so this where the public are being patient and helpful when they encounter awkward behavior by persons with dementia. So there are services that are trained to recognize persons with dementia and provide the support that they need. So including retail to transport to finance services. So this is what we meant that dementia-friendly communities, to help people feel inclusive and everyone can contribute to support persons with dementia. So everyone can play a part by supporting person with dementia. Okay, just take a little bit of your patience and understanding. Yeah. So I thought this is a very good a good slide for to approach a person with dementia with kind gesture. So KIND, K means keep a lookout. After we know what dementia is, how they present, it's really to keep a lookout for this group of people in the community. So what you can look for is will be the following behavior, like when you see any elderly looking lost, confused, or speaking incoherently because they have difficulty expressing themselves, don't know what they want, or they may feel very irritable, shouting. Sometimes they do have hallucination, like seeing things or hearing things they are not real, which can also occur in dementia. Or they might go to the police station often to lodge false report, or repetitive actions, or removing clothes, as I mentioned. They may not they may have inappropriate behavior. So these are some of the behavior that may be suggestive of that person suffering from dementia. And we do see, if we do encounter such case, do interact with them with care approach. Care, I will elaborate this in the next slide. Care stands for CARE, clear, simple, and patient. We need to approach them with clear language, acknowledge their concern, be respectful, and engage them with comfort and trust. Yeah. And N is really notice the needs of when we notice such group of patient, really need to notice what are the difficulty that they are going through. Need to consider their feelings and respond as appropriate. Because a lot of time they may feel very frustrated, but we should respond with lots of patience, empathy. Yeah. And sometimes we can use certain visual clues because person with dementia may have problem expressing what they want. But if you show them visual cues, it might be easier for them to recognize certain things, certain needs. Yeah. And we can ask them to show their when we build some trust and rapport with the person with dementia, we can ask them to show us their like cards, like ID cards, next of kin contact details. And next will be D. When we manage to get contact details, we can dial for help. If you can find any contact number, you can dial for the number for their next of kin to come and help and come and get the person with dementia. Or if you are not able to find any contact number, you can inform the security guard. Yeah, or if you're not sure if it's near your office, you can inform your immediate supervisor or even call the police or bring the person to the nearest police station. Yeah, so KIND would help us approach person with dementia. Okay, and the care approach is how we can communicate with the person with dementia. So once you have recognized that particular person, you want to really approach with a clear language, simple language, and really be patient. Give them some time, okay? Because they might have time remembering what they're doing, what they need. They may feel very scared. So we should use short and simple sentences, yeah, and really maintain a calming and comforting tone. Although I do know that a lot of seniors may have hearing difficulties, sometimes we may need to talk a bit louder, although it may appear like unpleasant or rude, but in fact, we should try to engage the person with a calming tone, even though it could be a louder tone. Okay, and really speak clearly. Do not ask long question or compound question. You must ask them simple question. Give a simple language, like for example, you find an elderly an auntie wondering, so the approach and ask the auntie, where are you going? Or are you looking for someone? So really ask them very simple question, short question. I don't ask them, auntie, where are you going? Who are you looking for? Are you waiting for a daughter? So you don't ask too many questions in one sentence. They are not able to pick up. So and speak at a slower pace. Right? And sometimes because of their hearing loss, when you recognize that, you want to ask them whether they bring along with their hearing aid, or you can ask them which side of the ear that they can hear better, so that you can talk nearer to that side, right? And A would be really acknowledge their concern. Once they open up and talk to you, really Maintain eye contact to show that you are listening, you are paying attention. Do smile so that to ease their tension. Be attentive and really be prepared to spend more time with them because they may take time to really answer your question. Yeah, and really approach them with respect. Be respectful and reassuring. Sometimes it may be in a busy street. You may want to bring them to a quieter corner and give them some time to think. Because sometimes when in a busy street or busy situation, they may not be able to focus on your question. They may be distracted by the people passing by or other people talking. So bringing them to a quieter location or quieter place or corner will be helpful to so that we can communicate better with them and give them. They might feel less anxious, yeah, and also to give them some time to think and respond. Because if imagine if they are in the busy street, they may get very irritable. Like, why is everyone walking around but no one? No, why is there a lot of noise? How is this person talking to me? I can't even hear the background noise. So sometimes really important to bring them to an appropriate place. Yeah, and importantly, it's really always show a lot of care, concern, empathy, encourage them. Sometimes you may tell them like, I mean, once you build rapport, you may want to touch their hand and say, I know now during COVID, we try to maintain distance, not, not, not have too much contact, but sometimes we just want to smile and show them, maybe they cannot see behind the mask, but show them eye contact. Tell them that you are there to help. Yeah. Tell them that it's okay. Take your time. I'm here to help you. You want to tell me where you are going, things like that. Yeah. And E would be engage and provide comfort and build trust. Yeah. Really be friendly. They can read your body language. Yeah. And maintain a comforting presence there. If you appear rushed or looking at your clock, I don't think they will feel comfortable as well. Yeah. So build a trusting relationship and ask appropriate questions. Ask them what do they prefer to speak, which language do they prefer. Can they understand Hokkien? Can they understand Mandarin? Really communicate patiently with them. Okay. Then you can ask them to show you ID. Sometimes you can bring out your own IC and ask them, do you have this? Or show them picture. Do you have this identity card with you? So you can see, sorry, you can see that this is the ID card that they may have with them. This is the special needs card, actually provided by NCSS, or what we call a safe return card. It's not just for dementia, but also for other like intellectual disability group. So in this card, you can find their name. Sometimes it might be good to ask them, what's your name? What can I address you? Uncle Lee, where do you stay? And you can look at their card, the information in the card. Like you provide information such as residential address or even emergency contact number. And I think some of these cards have QR code where you can scan and get more information. If they don't have this card, usually they'll bring along their EasyLink card or even their IC. It will be helpful because IC will state their address. Yeah. And sometimes they may even have a special sticker on them. It's called ICD, in case of emergency sticker, which they can obtain from Goto Points, which maybe stick on the concession card. Sometimes they stick on their Pioneer Generation card or even on their IC. So here, usually next of kin will obtain this and put their name and contact number here in case person with dementia goes wandering, then they can find their way home. Okay. So if you want to go a step further, you can, if you are you want to help to bring the person back home, or or if you stay nearby or that place, you can do so. A lot of time you can also bring them to a certain area or what we call safe return point. These are the go-to points. You can find this in the Dementia Friendly Singapore website on the link. You can also sign up as a member of Dementia Friendly Singapore. And when you Google, you can find this nearest Goto Point. The Goto Point also serves as a safe return point where you can bring person with dementia to that area. Yeah, but it also serve as a resource center where they have the staff there are trained to provide like information and useful resources on dementia and link the person with dementia and the caregivers to relevant services. So if you do have this app, you can Google your location and then you can search for the nearest go-to point. It will tell you how many meters to the next nearest go-to point. It can be the nursing home, it can be a day center, a bus station. A lot of time, participating participating stores will be like Guardian. Yeah, and I Google nearby here there will be like Guardian in nearby Sengkang will be Guardian in Campus One, Guardian in Waterway Point, or even the police station. Okay, all right. I'm not sure. I guess we still have some time. Before that, I do have some videos that I thought would be helpful to share because they does provide a gist of the topic or discussion today. Before that, before the video, you all following me so far? You all have any question? If not, we can also do the Q&A at the later part. And I think the go-to points may not be 24 hours though. Yeah, because they are like participating stores like Guardian. Don't think they're open 24 hours. Some are like bus station or even police station. So yeah, okay. So why Asia has the highest? I have no answer for that. Not sure what's the reason, but how can we prevent dementia? Okay. So looking at the question, okay, how we can prevent dementia? Actually, dementia, there are many factors though. Aging is one risk factor, but there are a lot of other risk factors, including genetic, which predisposes someone to Alzheimer's dementia. Other forms like vascular dementia is because someone with vascular diseases, they are at much higher risk of vascular dementia. Yeah, head injury, head trauma, all these can lead to dementia. And there are other more uncommon type of dementia that I didn't mention in the slide. Is like alcohol dementia, or even HIV dementia. So, in general, how can we prevent dementia? Well, what we can do is to really maintain a healthy lifestyle. We want to prevent chronic diseases because all these chronic diseases like diabetes, hypertension, high cholesterol levels all can lead to stroke, and all this can also increase the risk of dementia. Healthy lifestyle, healthy diet, uh, also to have more activities. Okay. So there are studies shows that people who have higher education level, have higher cognitive reserve, they have lower risk of dementia. Yeah. So maybe well you can is to engage with pick up more skills, learn more things, more new things, learn new skills, or go for workshops, engage in activities that will help stimulate your brain activity, like like calculation, sudoku, even mahjong helps with dementia, it helps with memory as well. Yeah. Okay, and importantly is to avoid all the other unhealthy lifestyle like alcohol, smoking. All these can increase the risk of dementia. Okay, next question is does the okay for Q&A later, huh? Okay, yeah, answer some also, yeah. Does a daycare center have right to suspend patient with dementia who has difficulty keeping their mask on? I'm not sure about what the rules and regulations the daycare centers have, but I think generally it'll be good to keep reminding them unless they really have behavioral agitation whenever they put on their mask or they have a very bad respiratory condition. Sometimes we may I do have cases where we do write like a memo to allow them to use face shield instead of mask. But again, that might also be very uncomfortable and may cause a lot of confusion among patients with dementia. So it can be quite tricky. Yeah, and also because we know that there have been cases where the COVID infection started in the care center, so it might be very strict with that. Okay, all right. So, how do you diagnose dementia clinically, and what do patient or family members go about doing this? So, dementia, clinical diagnosis is dementia is really, we really depend a lot on the family members' history, like how long the dementia started, what are the difficulty that the patient faced, what kind of difficulty. Dementia may a lot of time present with memory problem, but it can also present with other problems first before the memory problem, like coordination problem, slowness in their thinking, yeah, or even speech problem, which or behavioral issue as well. Okay, so clinically, really based on we follow our DSM-5 criteria for diagnosis of dementia, but usually we look at several aspects: memory, language, memory impairment, language impairment, the ability to do familiar things like the basic things like buttoning their clothes, um, using gadgets like remote control telephone, combs, yeah, and then recognizing familiar people, familiar places, or even some more complex tasks like managing finances or organizing, I don't know, a feast, cooking, for example, or organizing a family gathering where they need to cook a big amount of meals. So all these more complex tasks will usually be affected first. And when the dementia progress, the more basic function will be affected to the point where they may not know how to manage or feed properly. Okay, or they don't know how to shower on their own. Or they may not even recognize motion or urine. So sometimes they may soil themselves or they may wet their pants. Okay, so when we diagnose dementia, uh, we do also do certain like cognitive skills, and if we are in doubt of the diagnosis, sometimes we do refer them to more complex like assessment, what we call neuropsychiatric assessment by the psychologist, where they will assess every function of the brain and see which area that is particularly affected. Yeah. Okay. If we do suspect a family member or friend having dementia, how do we get them checked for it? So is there any way of slowing down dementia? Okay. Yeah. So we do. There should be my subsequent slide. Maybe I can show you a little bit more. Okay. Maybe later. Okay. So when we do suspect friends or family members having dementia, what we can do is we can bring them to the nearest clinic, like the GP. Some of the GPs are actually trained to pick up dementia, diagnose dementia. Or you can bring them to the nearest GP or polyclinic for them to be screened in the primary care setting. Or if they are not able to manage or they are not or they are not trained, they can then make a referral to the hospital. Okay, so usually they will refer to the geriatrician or even the psychogeriatrician, which is the psychiatry department, and some of them may be referred to the neurologist. Okay, um, if I'm not mistaken, there are some community services that provide like screening services to screen for people with possible mental health condition or dementia or cognitive problem, and they are linked up with some hospital like IMH, where they may do a post-screening subsequently in the community. Okay, so behavioral character. Okay, so, sorry, what do you does behavioral character link to mental health? I'm not too sure about your question. Maybe Sunny want to clarify your question again. Mention behavioral character. Mm, so Sunny, do you want to um, Can I clarify what do you mean by behavioral character? Okay. Well, I think it's okay. I think behavioral character means probably more like behavioral changes. Behavioral. Sometimes we would say that BPSD, which we commonly use term behavioral and psychological symptom of dementia. So in this case, the dementia patient may have behavioral changes. As I mentioned, they may be depressed, they may be anxious, they may have psychotic symptoms. For example, uh, being suspicious, paranoid, having delusional belief, fixed false belief about things around people around them. Some of them may even have hallucination, seeing things or hearing voices that might not be there. So these are some of the behavioral changes that may be linked to dementia. Some of them may appear disinhibited as well. I have cases where the uncle actually was not aware of what he's doing, but he actually have a problem with a part of his brain, the frontal part of the brain, which controls inhibition, which can be also affected in dementia. So he would throw his urine out, and another case where he touches the touches the body parts of some passerby. Yeah. Okay. So how long estimated, next one, Gabby asks, how long estimatedly does it take for a person go from MCI to early stage of dementia? So MCI is mild cognitive impairment. Yeah. So mild cognitive impairment is like almost like pre-dementia stage, where a person may have cognitive impairment. It might affect them, but not significantly in their life, and family member do observe some changes. Yeah, so MCI to early stage dementia very tricky. Sometimes they may not even progress to early stage dementia, but often when they do progress, it may range from months to years. So it's really depending on what the further brain insult. So as I mentioned, that's why it's important to manage their lifestyle, their diet, control the risk factor like the chronic diseases, their diabetes, cholesterol, prevent stroke. Okay, stop smoking, drinking. All these can cause problems, more insult to the brain. Yeah. Okay. Right. I hope I didn't miss the other question. Okay. Any more question? You all can also turn on your mic and can ask me as well. Welcome. You can type in again. You can type in more questions. While I can show you this video, which I actually found in Dementia Friendly by the Dementia Friendly Singapore. Um, I signed up as a Dementia Friendly member, and they do have a lot of very helpful resources. Which later I will show you a slide. A lot of helpful resources to tell you more about dementia and how you can play a part in the community. And this video I thought very helpful because it really summarized the approach to persons with dementia. Okay. Yes, let me try to stream this. Okay, now just give me a while. Oops. Okay, now let me share my slide. Let me share my screen.
Dr. Seow, your screen is shared already. We can see your screen,
Oh,
except that it's not.
shared already.
Yeah,
Okay,
it's
great.
it's not on
Not,
it's not on
I
slide
will.
share. Yeah.
This one you can see full
Yeah.
screen.
Yeah. You need
Okay.
to slideshow. Yeah.
Can
Slideshow.
see. Wait, slideshow, huh?
Yeah. You just go
You
to
mean you can't see the
slideshow.
whole? Wait, I'm very bad in this.
It's okay.
Slideshow. Where's the slideshow?
Yeah.
Yeah. I can't find the slideshow.
Okay, you see the bar at the top there, right? File, home, insert, design. You go to slideshow. See the bar at the top?
Such thing.
Huh?
Yeah, there's a mute, stop video, participant, share. Where's the slideshow? Sorry, I'm terrible
It's
at
okay.
this.
You know at the top of your PowerPoint,
At the top of my PowerPoint, I see.
Yeah, you see at the top of PowerPoint, file, home.
This one, is it?
Further up. You need to go up. No, you got to go backwards, just onto that page. Okay, you go along that top slideshow. Yes.
But it's not linked though. Sorry, it's not linked though. It's not linked to my
So can you
the
click
file.
on? Can you click
Can I
onto
share?
the?
Can I?
Yeah, then you can
New
share on
share?
the chat. Can you share on the chat?
Share in the chat. Can I put a new share?
Share the cut and paste. Can you cut and paste copy and paste onto the chat?
Can you see this?
There. Yes.
Okay.
Yes.
Can okay.
Yes.
This is a very good video by Dementia Friendly Singapore. Can you hear the sound? Can you hear?
Wait. Yes, slightly.
Slightly, huh? Okay, I increase the voice.
Yeah, we can hear the sound softly.
Okay, excellent.
You know where my home is?
He appeared quite lost, like he doesn't know where he's going.
Go home. Can you take me home? Oh. I'm meeting my daughter here for lunch.
Uncle, are you ready to order yet? We've been waiting for some.
Not yet. My daughter will be here soon.
Okay, no problem.
I told you already. She's going to be here soon. I'm meeting her at home.
Uncle, wait. You want some help?
Where am I? This is not my home. I want to go home. Can you take me home?
Take a look at this. Thank you.
I walked into the right restaurant today.
Hi. Your father has been at our restaurant for a few hours. Okay, thank you. Bye. Uncle, your daughter is not ready. You must be hungry. Hold on for a while. Yes.
It may not be my home, but it's nice to be around.
should you do if you come across a person who may have signs of dementia? On the lookout for people showing signs of dementia, often performing daily activities. They may appear withdrawn or easily upset and may have difficulty remembering recent events. They may also struggle with reasoning and judgment and can lose their way in familiar places. Interact with patients, be friendly, and provide reassurance that you are there to help them. Notice their needs. Ask them for their identification, such as their NRIC or their next of kin's contact details. Call the next of kin or bring them to the nearest Goto point. Locate the nearest Goto point using the Dementia Friends app. It may be challenging trying to communicate with a person living with dementia. Remember to use clear and simple language when speaking to them. Acknowledge their concerns and be prepared to spend more time with them. Be responsive, engage with them to provide assurance that you are there to help them. If you would like to learn about dementia or have to keep a lookout for missing seniors, sign up as a dementia friend via the app today.
I hope that's helpful. I found this video very. They summarize very succinctly, very helpful for me. Yeah. Okay, let me see. Okay, let me share my slides with you. Okay. So if you are interested, you can sign up for the Dementia Friend app, and they have lots of useful information there. Okay. Can you see my slide?
Yes. So Suyin, there are quite a few questions in the chat if you'd like to take them.
Yeah. Okay. Can. I'll take them again at the end. Probably finish up this some of the resources. Yeah. Okay. So these are the agencies providing services and info on dementia. Again, I got this resource from AIC. So you can also go to the AIC Dementia Caregiver booklet, where you can find all the different resources like the ADAs, the NTUC, or the Seow Foundation. We also have a lot of other like family services, family care centers that provide services for the seniors. Yeah. Okay. So I guess caring for dementia can be challenging, but everyone can play a role in supporting persons living with dementia. Yeah. It would be good to have more awareness about the signs and symptoms of dementia and what are the resources that can advise the persons with dementia or even their family members. So knowing some of these resources center would be helpful. Yeah. So and also can you can also learn to be more respectful and support the seniors living in the community. Okay. So these are the three resource centers which will be very important. You can go to like the Dementia Friend app, the AIC where they have like dementia learning awareness, dementia awareness where you can go for an online course as Q&A. They'll tell you what are the signs and symptoms, how to interact with them. And so ADA, Alzheimer's Disease Association. Okay. Right. So these are the references that I got most of the information from. Maybe I'll take some of the questions. I think I've answered most of them. Okay. So I'm scrolling through the chat. Again, why Asia dementia rate so high? I'm also not that Asia.
Hi, Dr. Suyin.
Asian group. Hi, yeah.
Hi, Dr. Suyin.
Yes.
Can I ask you something for advice?
Yeah.
Actually, I'm taking care of my mom who is living alone. she is diagnosed with dementia, and and we have been going to the doctor, and then her condition seems like has deteriorated very fast. So I'm thinking, should I have a second opinion, going to another doctor?
I see, I see. The reason was it because you feel that the deterioration is so quickly that that you wanted a second opinion, or because you know, is there any other reason for second
No,
opinion? If you don't mind me asking.
because I think the doctor, the medication seems like it's not really taking effect. It should be stabilized the situation, but seems like you know, it's her deterioration is very fast. Yeah.
Okay, okay, all right. So from my experience of in dementia medicine, there are a few types. The different stages of dementia may benefit from the different types of anti-dementia medicine. Unfortunately, I would say that there are times where the medication may not be able to even stabilize or slow down the progression. And sometimes the doctor may change to another type or combine two types of medication. But if that still fails, then the medication may not help anymore. Yeah. So thus far, Singapore have at least three types of medication. So maybe you want to discuss with the doctor, and I mean everyone is free to seek second opinion, but there are different types of dementia, so they can be due to other reason why the condition is deteriorating very fast, and not because and the medicine is not working.
So she has not
So from clinical experience, sorry, okay?
she has not done MRI, but we are thinking of you know, sending her for MRI and see the brain condition. Is it advisable?
Okay. Yeah, MRI brain would be helpful to help us know the area that's affected and whether there's other like causes like the vascular, because in MRI or even CT brain you can pick up small blockages leading to infarct, what we call vascular ischemic changes. So that if it is purely the vascular type, the intervention will be different as well. And if there are other areas that is more other lobes of the brain that's more affected, it may affect the different types of cognitive function. And yeah, I mean, to go into it will be a bit complex, but basically to tell us the type and the type of dementia as well, result that is causing the progression of the disease. Yeah. So no harm with MRI. May or may not be very helpful, I must say. But usually when at least a CT brain should have been done. Yeah. Of course, more detail will be MRI. Okay. Yeah. So one more thing is really to control the disease, other chronic diseases. As you know, seniors they do have 2 or 3 types of chronic diseases, because further insult or even hospitalization can cause the cognitive decline to be even faster and go at a faster rate. So any seniors with memory problem, if they are admitted for any other reason, it may not just be infection, maybe a fall, or maybe a due to, for example, so due to other reason like renal problem or diabetes not well controlled. All these admission or health deterioration may increase the risk of the cognitive decline. So as much as possible to prevent that, but you know, a lot of things it's really difficult to predict. Yeah.
Okay, thank you.
I mean, short answer is if you're not very sure, you can get a second opinion, but I would think that you might want to discuss further with the doctor. Yeah. Is your mom attending daycare? May I ask? Sorry. Yeah, if you don't mind.
Sorry?
Is she attending like daycare center?
No, I
Because
am
other than
children. We are planning to actually apply for a dementia daycare center for her because she lives alone.
I think that will be also. Yes, correct. So it will be not just pharmacological intervention. The non-pharmacological intervention will be very important. Keep them engaged, occupied, keep their brain active. So daycare center where they will do activities to help, stimulate them, to let them play cards, Sudoku, interaction with people. Actually, also very helpful when they interact, they think, they talk. So it can anything that can pick up the brain function. It will be helpful. Yeah. So I
Thank you.
think no problem. Any other questions that you want to ask? You can type in, or you can ask me through you can speak through the mic.